Scottbookman, and I'm the Incident Commander for the State Public Health Department for COVID-19.
Rachel Herlihy, RACHEL HERLIHY, and I'm the State Epidemiologist for Colorado at CDPHE.
Wonderful. Okay, so this first question is from Vinny Del Judas at Bloomberg News in Denver. Thank you for all the briefings. Two questions. Regarding JBS in Greeley, how many packing plant workers and family members have tested positive for the virus or sought medical care? That's the first question.
This is Rachel. I can take that question. So we are working closely with the JBS facility and Weld County. Because those numbers are changing frequently, I think it would actually probably be best to refer that question to Weld County Public Health. They would have the latest counts on individuals that have been tested and positive test results, as well as, hospitalizations and any deaths that have occurred associated with that outbreak.
And the second question that he had submitted was, have you been testing workers at feedlots and other packing plants across the state or received complaints?
Yes, so there certainly are other facilities in the state that we've been working closely with, and our local public health partners have been working with. We know that obviously that meat packing in particular is a really important industry right now. It's a critical part of our critical infrastructure in this state and the country to ensure that we have food to feed our country. And so those employers are certainly a priority for us to work closely with and to respond to cases as they occur and ensure that they have the tools and resources they need, and an ongoing cooperative relationship with public health to respond to cases and control any cases and prevent outbreaks as quickly as possible.
This next question is from Ben Warwick at CBS 4. We've had many viewers reach out asking why grocery store workers aren't wearing masks. What does the state recommend for grocery store workers or people who work at home improvement stores?
Scott, I don't believe we have specific guidance around grocery store workers. There certainly is business-specific guidance, and there are recommendations for members of the community to wear cloth masks while they are out in public. There's also lots of other strategies that we've seen in retail locations that are remaining open and need to remain open. So things like dividers between customers and workers, limiting the number of customers in a facility at any given time, having customers spaced out. So I think that there are multiple strategies that those workplaces are using to protect their workers. Obviously, masks are an important part of that, but I think there's other strategies as well.
Aaron O'Toole with KUNC asks, JBS says it is not planning to test employees before they return to work at the Greeley beef plant next week. But rather than rely on a 14-day quarantine period, should the company be testing workers before they return to work or risk sparking another outbreak?
Yeah, so public health, especially Weld County Public Health, is working closely with JBS to ensure that the appropriate measures are in place to limit potential reintroduction of the virus into the facility. And that will include strategies around screening workers for symptoms and ensuring that individuals that are ill are not going to work. And so there is, a long list of disease control recommendations that we are working with JBS, and Weld County Public Health is working with JBS on.
Lily Tyson with KUNC, based on the efficacy of social distancing, when does the state project the peak number of cases will be?
Yeah, so that's an excellent question. And certainly we are looking to the data and looking to the modeling to really try and best understand that. At this point, we do seem to be experiencing a slowing of our increase and perhaps even a plateau in the number of cases with the level of social distancing, the stay-at-home order we have in place right now. I think it's really going to be over the next couple of days that we determine whether or not the level of social distancing that we've achieved with the stay-at-home order is enough to lead to a decrease in the daily case counts. We're really, I think, just starting to observe the impact of the stay-at-home order in our case counts, and today and in the next couple of days.
Forrest Wilson with the freelancing with the Colorado Independent. Boston, Ohio, New York, and Washington State all received newly FDA-approved sanitizing machines for N95 masks. The company producing these machines say they can sanitize up to 160,000 masks per day. Has Colorado looked into purchasing these sanitizing machines?
This is Scott. Yes, we have. We've put in a request through FEMA for a machine that will sanitize our N95s. We hope to have it up and running in the very near future so that we can keep our healthcare workers safe.
We have another question from Sam Tabachnik with the Denver Post about peaks. And he says, Scott said the state likely has pushed back the peak until May at the earliest. Do you have any updates from that projection today? And if cases do peak in May, when would that mean that we see a peak in deaths?
Scott, do you want me to take that question, or would you like to address that?
I'll let you address that one, and then I can fill in as needed.
Okay, great. So I think that there are a couple of things to think about. So, with the social distancing strategies we have in place, we know that we're achieving some impact on the amount of transmission that's occurring in the state. And we've certainly seen a slowing, perhaps a plateau in the number of cases. But I think what we are working closely with the modeling team on now is, what it looks like in, after the stay-at-home order is lifted. We know we need to implement a variety of strategies to control transmission in the state. And it is quite possible that, with those strategies in place, but not a stay-at-home order, that we could see increasing transmission again in the future. And so I think we are preparing our healthcare system to respond to a greater number of cases later in the year, as Scott mentioned. So that could be sometime in May or even perhaps later, depending on what we achieve with social distancing over the next couple of weeks and the other strategies we're using, including aggressive disease control, isolation, quarantine, mass testing, all of those things that we need to get in place while we're simultaneously increasing our healthcare capacity.
Kevin Vaughn with 9 News asks, can you tell me how many members of CDPHE leadership have been exposed to or infected with the novel coronavirus?
This is Scott. We're not releasing individual information on who was exposed. A number of us were, I myself was, and have been in quarantine for some time now, but we're not releasing specific information on how many and who.
John Ingold with the Colorado Sun. Do you have a better sense now of the number of people who have been discharged from hospitals after recovering from COVID-19? Is the number of hospital beds currently occupied by someone with COVID-19 rising or falling?
This is Scott. We are working with the hospitals now to try to gather that information so that we have a better sense as to how many people are being discharged, and we anticipate having that information available in the coming days. From our conversations with the hospitals, volumes do seem to be relatively flat. That's not to say that we aren't seeing a high number of COVID patients. We're just not seeing exponential growth, and so that is consistent with kind of that flattening that we've been seeing.
Ryan Har with 9 News. When might Colorado see widespread contact tracing? What might that system look like, and what kind of community participation would be needed to get useful results?
This is Rachel. So contact tracing is obviously a really important strategy for controlling disease transmission, and needs to be paired with a number of other tools, including, widespread community level testing. So the way that this would work as far as disease control and using contact tracing is that we would ideally want to identify an individual who has symptoms and have that individual, share their concerning symptoms with public health, coordinate testing of that individual, and then while we're waiting for test results, provide instructions to that person to isolate, and that their close contacts should be quarantined. When those results come back, if they are positive, it's again, enforcing the need for isolation. And then public health works on contact tracing and identifying all of the close contacts of that individual and ensuring that all of those individuals know that they need to quarantine to prevent further transmission of the virus. So it's really paired with a number of other strategies that we would use. And really our target for doing that is to, have widely available testing available in the state. We also, need to ensure that the daily number of cases that are occurring in the state are something that our public health workforce can manage. And so along with, implementing all of these protocols and guidelines that we're in the process of developing, we are also working to increase the size of our public health workforce so that we can respond to as many cases as possible and ensure that, comprehensive and prompt isolation and quarantine is occurring.
Sam Tabachnik at the Denver Post. Are there any promising vaccines or cures being developed in Colorado? Does the state have a timeline on when those could be available?
This is Scott. We know that there's research going on across the state, across the country, and across the world. Everybody is moving as rapidly as possible to develop treatments and vaccines, but we do not have a timeline on any of that at this point.
Taylor Summers with NBC News. 2 different groups of states announced Monday they were coordinating on their approach to reopen businesses as COVID-19 cases taper off. Is there a similar strategy in the works between Colorado and other surrounding states?
This is Scott. The governor is using any number of different strategies to identify the best practices and how Colorado will reopen. We have our innovation response team. We've got our public health experts, the governor's policy advisors, and then obviously we're looking at best practices across the country and really looking at the best way to reopen Colorado. And of course, that will involve conversations with our surrounding states as well.
This question is from Lily Tyson with KUNC. It might have already been asked. How many patients have been released from the hospital after recovering from COVID-19? And how much of the state's hospital capacity for treating COVID-19 has been breached?
This is Scott. Like I said, we're still working with our hospitals to really identify the total number of discharges, and we hope to have that data in the coming days. We have not seen any of our healthcare systems have their capacity breached. The social distancing orders that have been put in place have really flattened this curve and prevented that spike that we were afraid might overwhelm our healthcare system. But at this point, everything is intact.
Steve Stager with 9 News asks, is the state considering scaling back on plans for field hospitals in Loveland and Denver? We've heard the governor is considering cutting back on bed capacity because of the trajectory of the virus. Are we still rushing to get ventilators? Are we still trying to bring medical staff in from out of state?
This is Scott. We are continuing to evaluate the updated information that we are receiving. We are moving forward with construction that was started a short time ago at the convention center and up in Loveland. We may choose to scale some of that back depending on what information that we see. It's really important that we are prepared for any potential surge as we move forward in this, but we also want to make sure that we're using our resources appropriately. That does also include trying to get additional ventilators, PPE, and other things for our healthcare providers.
John Ingold with the Colorado Sun asks, do you have preliminary all-cause death data from the first 3 months of 2020? How does it compare to the same period from 2019?
This is Rachel. I can take that question. I have not seen that data. I think that's a great question, though, and certainly something important for us to be looking at. So I can certainly get back to you on that and connect with our vital statistics folks to see what that data looks like. You know, I think it's important to recognize that, you know, obviously there are infectious disease consequences and, you know, direct deaths that will be attributable to COVID-19 virus, but I think we also in public health are keenly aware of, you know, potential other impacts that could be occurring due to this virus and isolation of individuals and concerns about seeking care. And so that is certainly also work that we are doing and trying to really understand what other impacts might be.
Blair Miller with Denver 7 asks, what is the data showing us in regard to the effects of the stay-at-home order now? How long will we have to continue most of our social distancing measures in order to avoid another large spike?
This is Rachel. So, you know, as I said at the beginning, we are really just starting to receive that data now about the impact of the stay-at-home order. And we are working closely with the modeling team at the School of Public Health and CU Anschutz to really measure how much that stay-at-home order has achieved, so what level of social distancing it has achieved. And so we expect to have those estimates really in the next couple of days. And that work is really going to, I think, guide future strategies. So I think more to come soon.
Erin O'Toole with KUNC asks, how often will the state be releasing the data for race and ethnicity for COVID-19 cases? Is the state changing its approach to social distancing, testing, or treatment based on these numbers?
This is Rachel. I can take that question. So to the first point, I think we do intend to have this data regularly available. We obviously know that this data is a really important part of the story of COVID-19 and the burden of the disease in Colorado and who is being impacted. And, you know, like we see with many other health conditions, unfortunately, you know, we are recognizing that individuals who have, you know, long-standing issues with accessing health care and economic disadvantages are overly represented in case counts, at least by race and ethnicity. And so that's certainly concerning to us and data that we will continue to track. You know, these data are really just now have come in the last couple of days as we've been able to improve the completeness of that race and ethnicity data. And so we're certainly going to be taking a closer look at it and seeing how this data can inform future policy and, you know, potential disease control strategies going forward.
Lily Tyson with KUNC asks, how many doctors and nurses in the state are trained to operate ventilators? Is there enough to operate the number of ventilators that will be needed during the peak? If not, what is the state doing to train additional doctors and nurses?
This is Scott. I don't have those specific numbers available to me, but in our conversations with all of our hospitals, they believe that they have the capacity now to handle with ventilators and with nurses and doctors and respiratory therapists, really to respond to the volumes that we're seeing, and they continue to prepare to expand for any type of peak that we may see.
Sam Brash with CPR News asks, how does CDPHE plan to implement a COVID-19 surveillance system for phase 2 of the state response? Will it use smartphone data? Will the data be protected? And how many contact tracers would the state need to hire to contract out?
Yeah, so we do want to try and implement some automated technology to support contact tracing. At this point, you know, we haven't been pursuing, you know, using cell phone tracking data to support contact tracing activities. But we are trying to identify strategies that could allow us to collect data electronically from individuals instead of having to do, you know, manual interview of all of those individuals. So I think there's a balance in using technology to support this work. Obviously, protecting individual privacy is a priority of ours. Can you, I know there are additional components to the question. Could you repeat it?
Will data be protected?
Okay, I think I covered that. Okay.
And then how many contact tracers would the state need to hire or contract out?
Great. So right now, we are working at the state level to hire additional epidemiologists and student epidemiologists that could work closely with us to do this work. And similarly, at our local public health agencies, they are also working diligently to expand their workforce. So we certainly know that it is a priority to have a greater capacity to do contact tracing work. It is time consuming and resource intensive.
This next question is from Ellis Arnold with Colorado Community Media. Did the race and ethnicity data on Colorado's COVID-19 cases and deaths that was released yesterday come primarily from certain counties, more urban counties, more rural counties, Front Range, etc.?
That's a good question. I believe it was representative. I am not certain, though, if there were any gaps by region. So I don't actually have a precise response for that question. It's certainly our priority.
Oh,
sure. I'm sorry, go ahead.
Oh, no, that's okay. If you wanted to add anything, please go ahead.
Yeah, I was just going to say it's certainly a priority of ours to ensure that we do have that data comprehensively for across the state, not just in the metro area or not just in rural areas, but, you know, a comprehensive picture of how race and ethnicity might be impacting disease transmission and outcomes in different communities across the state.
Ellis Arnold with Colorado Community Media also asks, will CDPHE be requiring race data out of hospitals? What loosely does that public health order look like?
Yes, so there is additional data that we are interested in receiving from hospitals, and part of the story is race and ethnicity. So we are certainly pursuing ways to get additional data, both directly from hospitals, but also pursuing other strategies and working with health information exchanges and looking to other databases we have at the state to make sure our data is more comprehensive. So I think working directly with hospitals is one strategy, and we are asking for more completeness in reporting of race and ethnicity data, but pursuing other strategies as well.
Fox 31 Denver asks, do we still need to prep the convention center for patients based on the latest numbers, or does it appear to be no longer necessary because Colorado has flattened the curve? If it is being prepared, why? Might it be used for the homeless instead?
This is Scott. Like I said earlier, we are continuing to prep the convention center. We don't know what the future truly holds. And while the curve is flattening, we don't want to take our eye off the bigger picture. And we want to make sure that we have capacity built in case we see a surge in cases that overwhelms our healthcare system. And we're looking at it to really be that relief valve if our hospitals need it.
Aaron O'Toole with KUNC asks, what's behind the recent spike in cases in Morgan County? Are those connected to the meat packing plant there?
Mrs. Rachel, I can take that question. So we have seen cases, as you know, associated with the meat packing industry, and we are working closely with our local public health partners and those industries to investigate. So there also, I think it's important to keep in mind that when we identify cases in communities, we also encourage additional testing there to better understand the scope of transmission. And so it's not uncommon for additional testing to happen once we identify a couple of cases in a community to make sure we have a comprehensive picture of how much transmission is occurring and where that transmission is occurring and what risk factors might be.
I believe we've touched on this a little bit already, but I'll just see if there's anything to add. Ellis Arnold with Colorado Community Media asks, what are the solutions the state is considering to address the disparity in COVID-19 cases based on race? Any strategies for Black, Hispanic, and Pacific Islander or low-income communities in general?
This is Scott. As Rachel, oh, go ahead, Rachel.
No, go ahead.
As Rachel said earlier, we all know that there are long-standing disparities in access to care, and really that's where our focus needs to be. We still need to develop an understanding of how this illness impacts everyone, but we know that an important factor in all of this is access to healthcare.
It's about 11:27, so I'm just doing a quick time check. We'll take questions for a few more minutes. This next question is from Marianne Goodland with Colorado Politics. What is CDPHE doing with regard to non-hospital healthcare facilities, given that the number with outbreaks has more than doubled in the past week? Is more testing planned, more PPE? We're hearing from at least 2 facilities that COVID-19 patients are being moved to these facilities, but they may lack adequate PPE.
This is Scott. Obviously, a lack of access to PPE is a huge challenge for all healthcare workers, whether in a hospital or outside of a hospital at this point. There simply isn't enough PPE to go around. The state is doing everything we can to procure as much PPE as we can, and we're hoping the supply chain will come back online here in the coming weeks, but we understand right now that access to PPE is a huge issue. We are watching these facility outbreaks. We are reevaluating our practices and making sure that the executive order that the governor signed early on is being enforced appropriately to make sure that we aren't having any visitors going in there. And then we are really looking at increasing our testing capacity across the state. We know that we need to increase that testing capacity, and we will target outbreaks as we can.
Ellis Arnold with Colorado Community Media asks, aside from limiting visitation, which was done in March, what more now can be done to prevent the spread of COVID-19 in nursing homes and group residential facilities?
This is Rachel. I can take that. So we are working closely at the state with our local public health partners to, aggressively investigate those outbreaks that are occurring in nursing homes. As we've seen across the country, this illness is really disproportionately affecting older people and those with comorbidities. And we know that, as you mentioned, the governor took action early by stopping visits. And, we're really, I think, working on trying to identify what ongoing risk factors might be. An important strategy, as Scott mentioned, is ensuring that appropriate PPE is available in those facilities. And, we're continuing to look at the data and understand what risk factors might be and how we can further intervene. It's certainly a priority of ours to understand if there are additional strategies we can implement to really try and protect that really vulnerable population.
All right, so we're right up here at 11:30 right now. So before we sign off, I'll just have Rachel and Scott both state their names and spell their names, and then also state their titles for everyone. Scott, would you start?
All right, this is Rachel. I'll go. Rachel Herlihy, RACHEL and I'm the state epidemiologist.
And Scott Bookman, SCOTTBOOKMAN, and I am the incident commander for CDPHE.
All right, well, thank you so much, everyone, for joining us here this morning. We really appreciate it. Have a great afternoon.